Hello and welcome to my presentation in amputation in dogs, both pelvic and thoracic limb. Amputation of limbs are often required on medical grounds. These may be a component of treatment for traumatic injury, peripheral neuropathies, vascular compromise, infection, osteosarcomas, neoplasia, or deformity. The removal of the limb alters significant biomechanical changes. Anecdotally, observations by owners in a survey indicated that some dogs were not able to return to normal locomotion post-amputation. However, it appears that dogs adapt well after removal of limb through compensatory mechanisms. These allow the dogs to propel themselves forward without losing balance, being very adept to locomoting tripedally. Beginning with the hind limb in kinematics, there are significant changes in angular excursions recognized in several joints of each limb during the stance and swing phases of locomotion. Kinematic data in a survey by Galando Zamora et al. In 2016 displayed differences between mean angle progression curves for all the analyzed joints. During trot, there is an increased range of motion in thoracic vertebrae 1 and thoracic 3. And an increased vertebral expansion in lumbar 7 in the sagittal plane. In the horizontal plane, amputees had an increased lateral bending towards the remaining pelvic limb, resulting in a laterally deviated gait pattern. Additionally, increased range of motion in the hock has also been observed in the remaining pelvic limb. In the forelimb, there is significant carpal joint range of motion increase. And also there's an increase in the ipsilateral stifle and hip joint as a result of increased inflection of amputee dogs. Similar to hind limb amputation, forelimb amputees also displayed a unique bending in locomotion, resulted in altered motion of the horizontal and sagittal planes. Onto kinetics. In the forelimb, braking ground reaction forces increase in the remaining thoracic limb and similarly in the pelvic limb ipsilateral to the amputated limb. Dogs spend more time braking with the remaining forelimb to compensate the loss of braking force from the amputated limb. Comparable to pelvic limb amputations, no changes in braking force has been observed, but more time to reach the braking force is used. This is due to the loss of propulsion in the hind limbs and a greater decrease in propulsion in the forelimbs. Pelvic limb amputations have increased propulsive forces. This is due to the loss of propulsive forces from an amputated limb and is compensated by an increase of force in the ipsilateral thoracic limb and the remaining pelvic limb. Meanwhile, forelimb amputation has an increased propulsive forces of the contralateral limb and a decreased forces in the ipsilateral limb. There has been one study that observed kinetic changes before and after amputation. This longitudinal study observed no significant kinetic changes. However contradictory, this may be due to extreme lameness and pain leading up to the amputation with compensatory locomotion and non-weight bearing on the injured limb. Therefore the results showed no changes. Tripedal locomotion requires collected kinetic adjustments on appendicular and axial systems. Normal dogs carry 60% of their weight on the forelimb and the remaining on the hind limb. However, when tripedal, compensatory changes to the dog's weight distribution changes. In thoracic limb amputation, the remaining forelimb takes more weight. However, in pelvic limb amputation, the weight is shared more equally. However, additionally, it has been observed that contralateral limbs also share an increase in standing weight. Stance duration increased in trotted amputated dogs without a change in peak vertical force. This indicates that the same force is distributed over a short amount of time, resulting in a shorter gait duration. However, when comparable to another study where the walk is shown, a decreased stance duration results in a decreased vertical impulse. This shows that different gaits have different compensatory strategies. It has also been observed that the ground reaction forces on the opposite limb to the amputated limb are greater. Rehabilitation and therapy is considered a component of successful post-operative recovery, with all owners in a study using rehabilitative services post-amputation surgery. Owners' commitment into rehabilitation of the dog are important factors in a better quality of life. Phantom limb pain is often reported in humans post-amputation and is mostly seen in those that suffered pain before the limb is removed. Therefore, it's theorized that animal amputees may feel the same, and have been noted to see self-mutation and inflict wounds on the beginning of the amputation site, which may suggest that this theory may be true. Additionally, prosthetics are a growing interest in veterinary medicine. These aim to restore full mobility and increase the quality of life without risking deterioration of the joints. As noted earlier, the gait changes of longer stance duration indicated that a higher load is applied over the duration of the stance phase. This may be a detrimental issue for dogs, leading to osteoarthritis, joint dysfunction, and cartilage degrading. This is especially more common in larger dogs. Therefore, low-impact activity such as hydrotherapy reduces the impact of the joints. Additionally, due to compensatory changes in movement, more muscular power may be recruited from individual muscles and may lead to muscle strain and injury. For instance, in a study by Fuchs et al. 2015 using electromyography, tripedal dogs with a singular pelvic limb have seen that vastus lateralis muscle is activated for a longer period of time when compared to quadrupedal dogs, as seen in Figure 5. Similarly, the latissimus dorsi has a greater burst of activity in the contralateral limb, reflecting asymmetrical changes in the musculature. Overall, amputation affects the biomechanical locomotion of the dog significantly, including changes in ground reaction force, impulses, contact time of limbs, and the changes of centre of gravity. Forelimb amputation results in a greater biomechanical change than the hind limb, and those with forelimb amputation struggle with balance and fall more often. The use of research technologies in biomechanics provided a greater field of knowledge, enhancing the ability to specific segment joint and overall limb excursions in biomechanics that cannot be easily identified by the human eye. There is still a large gap in research surrounding amputee gait biomechanics. Additionally, there is no papers looking in depth into the rehabilitation post-surgery or long musculoskeletal changes on canine amputees. When comparable to the human amputees, physiotherapy is a crucial part of returning to mobility. I appreciate the time you spent listening to my presentation. I will include the references in the following slide. However, I also will attach the references in a Word document for you to be able to view on submission.